Well, unfortunately, we've heard horror stories from some of our patients as well prior to them coming to see us. Both Dr. Patel and myself have taken a tremendous amount of additional CE and both feel very, very comfortable and competent in nearly all aspects of endodontics or root canals. A root canal essentially is a patient has had trauma to a tooth, a large cavity, or a fracture to a tooth that has gone into the pulp. So the tooth basically has your outer enamel area. The inner portion after that is the dentin, and then you have the pulp, which is the connective tissue and blood supply to the tooth. If that infection, that fracture, or that decay has gotten into there, that's when you're going to need to have a root canal done. And in this day and age, with the technology and advancements that we have, in most cases that is done almost painlessly. We get the patient comfortably numb, we open an access to that tooth, we clean out the infected area initially with some small hand files, and then by a rotary file we irrigate and sterilize the inside of the tooth, and then put a filling material into the root surface called gutta percha, which is like a rubber substance that's cemented into place. Once that area dries, we come back and we put a cap or a crown, as we discussed earlier, on top of that, which is going to protect that tooth. Main reason it's really important, there's some instances where we may not recommend a crown, but in almost all instances we will. Once a tooth has had a root canal done and there's no blood supply to that tooth, it's much more prone to fracturing. So real important that we make sure we cover that tooth afterwards. Unfortunately, you hear patients sometimes say that I had a root canal, it didn't work. In most cases, when that has happened, it's because they didn't finish the entire treatment. So we look at a root canal as a three-step process: the root canal, the buildup, and then that protective cap that goes on top.